A man was examining a patient's teeth. He checked very carefully, but he couldn't see any serious problem. However, the patient kept shouting that he had terrible tooth pain. There was no visible issue anywhere, yet the patient's pain was extreme. Seeing this, the man felt something strange. He looked again carefully at the patient's dental X-ray. In the image, there were some white marks near the root of the tooth, but he didn't pay much attention to it and told the patient to go home and rest. After a while, when the man was about to leave, he saw some worms in the sink. He was shocked and immediately picked up the water filter. When he looked at it closely, he felt disgusted. The filter was full of insects and worms. He almost felt like vomiting and quickly threw the filter into the trash. But then a thought came to his mind. He quickly ran back to his office. He zoomed in on the old X-ray again. The white spot he had seen earlier was actually worms. The man had never seen worms like that before. He went straight to the library and started researching. After searching for a long time, he finally found information about them in an old book. It turned out that these were a special type of parasite called toothworms. They lay eggs near human teeth and slowly move inside the body, even reaching the brain. These toothworms had been seen years ago during a bio-experiment and were never seen again afterward. Reading this made the man extremely shocked. Just then, he received a call from the hospital. The same patient whose teeth had worms had come back again. This time, he was in even more pain. Now that the man knew these were toothworms, he became a little frightened. He knocked on the door and showed a glass to the nurse, saying, "For safety, wear protective glasses and gloves." But the nurse didn't take him seriously. She simply said, "Go, and help the patient quickly." The man had no other choice. He wore a protective suit and began preparing for surgery. But as soon as he injected medicine into the patient's gums, the patient suddenly started screaming loudly. It seemed the worms had sensed the danger. They quickly started moving toward the patient's brain. The patient's eyes turned red. Seeing this, even the doctor became scared.